Periprosthetic joint infection is a really challenging diagnosis. It's not only challenging for me as the physician in terms of making the diagnosis and then the treatment, but it's really, really hard on the patients. It estimated that 1 to 2% of hip and knee replacements will be complicated by an infection. The diagnosis of periprosthetic joint infection is unfortunately associated with substantial costs to both the patient and to the healthcare system. We're almost always talking about a surgical procedure, which means a hospital stay, antibiotics, nursing care, antibiotics after discharge from the hospital, oral antibiotics. When you're looking in terms of treatment for periprosthetic joint infection, you've got a couple of different options. In the early postoperative period, say in the first couple weeks after surgery, I think a lot of surgeons will still make an attempt to open up the knee joint, do what we call a debridement. Unfortunately, I think most contemporary series would suggest that the success rate is around 50%, which isn't great. Treatment of periprosthetic joint infection is associated with a mortality rate that's similar to many cancers, such as breast cancer. So I think the idea of having a non-traditional antibiotic drug that works differently and something that can potentially help get the bacteria off of these metallic implants that don't have a blood supply is really exciting to me, because needless to say, 50-50 isn't good. Well, it's going to be utilized in the operating room and applied similar to an irrigation solution right at the site of the periprosthetic joint infection.
I think what makes this study very important is that the current available treatments for prosthetic joint infections are just not efficacious. Patients are having to come back for another surgery. They're having to be on antibiotics for a prolonged period of time. And by the way, antibiotics do have a lot of side effects. They have a lot of toxicities, especially when you're on for weeks, months, and sometimes years, lifelong. So this study can really change the treatment paradigm in terms of curing patients, higher rate of efficacy, but it also could reduce the amount of antibiotics patients need to be on. As a peptide, it's differentiated from traditional small molecule antibiotics because it has a lot of favorable attributes, such as, number one, being able to penetrate and dissolve the biofilm, that slime that bacterial cells make. Secondly, it is broad spectrum. It works against not only gram-positive but also gram-negative bacteria, including bacteria that are resistant to antibiotics. Thirdly, it is rapidly bactericidal. It kills bacteria as opposed to just inhibiting their growth. And then also it has very low propensity for developing resistance.
Well, I think if the experimental drug 206 works, I think it could lead to a big improvement and change in the way that we practice and treat patients with periprosthetic joint infections.